Welcome to the LowCarbUSA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine.
Okay, so the other day, Pam was being interviewed by Brian and Tro for the Low Carb MD podcast, and she kind of felt afterwards that there was so much that she wanted to say about the LowCarbUSA organization, how far we've come since we started, and then how the SMHP spawned out of that, and all the things that the SMHP is doing. And Brian and Tro kept asking her about like personal stories about how she punched me in the eye and gave me a black eye during our martial arts and stuff like that, but not speaking so much about the organization. So we decided, since this is our 100th episode, that we actually take the time to talk about that, talk about the journey, the last 7 years, how far we've come. And Pam was saying, like, a lot of the stuff that's going on behind the scenes that people make comments about, and that when they have no idea what actually is going on behind the scenes, because we don't talk about it at all. And probably that's a problem, and we should talk about it more, tell people about what's going on in the background. So yeah, Pam, why don't you talk about all the things that you thought you didn't get to talk about with Brian and Tro?
Now I'm sitting here trying to remember, and like, it was a really great idea. At the time I was all excited. I'm like, we should celebrate. So our 100th episode, it's pretty amazing to me to think about that. I've seen others who've gone, they're already way past that number, but when we go back and think about when somebody approached Doug, he'd already been doing some YouTube interviews type videos, and someone came to him and said, you should do a podcast. And first thing he said was, no, I don't really want to add a podcast. But he kind of had the idea of making it a little bit different and doing something that might be keeping it short, 15-20 minutes. We haven't always stuck to that because there's always so much to talk about, but it gave him a little bit of a push to say, I could probably manage that, a short video, a couple of times a month, interview a few people in the space who've just had amazing success stories or doing incredible work, or talk to the speakers about the research or clinical outcomes. And the Low Carb USA podcast was born. And I just had to go and look back at episode 1. It was back in July of 2019. And we're recording this just at the end of the year of 2022. So 3.5 years on 100 episodes. It's pretty cool. Congratulations, Doug.
Yeah, but I mean, that's just the podcast. We were going for, 3-4 years before that as well. So
yeah,
I'm thinking more in terms of everything we've done at Low Carb USA. It's like sometimes you seem to remember these things when we're actually talking about it to people and whatever, but it's like all a blur for me. So much has happened. So that was what I was kind of hoping you would remember, is all the stuff we've done and like highlight our journey.
Sure. Because I know a lot of people like, if they want to interview me, they'll ask me to go back to the beginning. And I always remember specific things about the beginning. And then I get to a certain point and we run out of time, because 7 years doesn't fit into 30, 60, 90 minutes, whatever we're doing. So, to go back to the very beginning, Doug and I were introduced to ketogenic diet in 2015 in the summer. And he got an email that said, ketones, an alternate source of fuel than glucose. And he said, wait a minute, what? I've never heard of this. So he went down a rabbit hole and got really into the scientific writings that he could find online at the time. It was mainly Jeff Volek and Steve Finney. That's who you found first, right, Doug?
Yeah, and Tim.
And Tim Noakes. No, you didn't find Tim Noakes until...
Oh, no, that's true. Only till months later.
Yeah,
that's true.
Because you were first found the articles and maybe the book, The Art and Science of Low Carbohydrate Living, and The Art and Science of Low Carbohydrate for Performance. And he looked at all the articles that he could find from them. And then I'm pretty sure you ordered the books, Doug. And about 2 weeks went along and I kept saying, are you still reading about that ketogenic diet? And he's like, yes, fascinating. And you literally like didn't work on any of the work that you were doing at the time. You were just like heads down looking at this. And I hadn't read any of it with you, but you put on the movie, The Serial Killers, the movie, Cereals, Killers, the movie. And that got my attention because it was playing in the background while I was doing other things, and I kept hearing certain things. And then I finally sat down and I really listened. Donald was looking at it as for performance and weight loss and optimal health. And he kind of described how he started, how he felt, what he was doing along the way when he tried to work out. And it was really interesting to me. And then sometime within that next week, I think you even watched the second one where Sami Inkinen was. Or had that not
I
come
don't
out
think
yet?
so. But I took you shopping. That was
I know. Then you said, I'm going to pull the trigger and I've written a list and we're going to the grocery store. And I always tell this part of the story because it cracks me up. I had to say, Doug, wait a minute. Not only have you made a grocery list, you're going to the grocery store with me. So when we decided to form LowCarbUSA, make the website, one of our ideas was to start as, let's help other people learn and start when we didn't really have those resources. We kind of pieced together little different things on from different places on the internet, from online. And Doug created a Keto 101 course. Along the same time frame, in the first couple of weeks, we had the idea to start planning our first conference. And the course kind of took a back seat when we started realizing that the conferences could really have an impact. When we first started planning our first conference, we didn't realize Doug said, we want to get 1,000 people in the room. Why don't more people know about this? And people were buying tickets and even somebody bought the first ticket and we hadn't even advertised it. We don't even know where they found it.
no, we
on
were
the
still
internet.
we were
It's just
still
like,
debugging this website. We hadn't even yes. Yeah. I still want to find that person and try and get her to come to another event. I haven't been able to contact her again.
you remember
But
who
yeah,
it was though, right?
I've got her name somewhere. Yeah.
Yeah. And people started writing to us and saying, do you know how much this means to me? There were 2 people local here to San Diego to us, and they couldn't believe that the people that they had learned how to heal and recover, lose weight, help any chronic illnesses and these people were coming to their town because we were putting this together. And Doug would read it out loud to me, and we couldn't believe it because we didn't have any idea about what this was going to mean to people. And one of the persons actually lived right down the street from where we were living. She worked right down the street. And she wrote to us and told us that her son had a really rare illness and that she belonged to a group of people on Facebook who were talking about the ketogenic diet for McArdle's disease or glycogen storage disease. And she couldn't believe that this was, becoming a little bit more public and that there was going to be this opportunity for people to learn. And she invited a handful of people. She invited a bunch of people from the group, and a handful of people from around the world came and attended. So we were like, okay, this means that much to this group of people. And then we met more people at that conference that had healed personal stories. We had more physicians and nurse practitioners and PAs come and tell us how much it meant to them personally and for their practice. So we really started to realize how much this meant for the healthcare professional. And then we really knew that's where we wanted to focus and make sure that healthcare professionals that were aware of this information, first of all, and second of all, that there were conferences like this that they could come to learn from. But just, to go back, that was our first conference, and we really didn't know that we were going to plan a second and a third conference. And here we are at our 18th conference coming up in Florida this January 2022. It's been a long journey that we didn't know we were embarking on at that time in 2016, the beginning of 2016. We had people almost begging us to buy tickets for the next year at that first 2016 conference here in San Diego. And we were like, but we don't know who's going to speak. We don't know where it's going to be. And they said, if it's anything like this one, we will buy tickets now. And we know that it'll be just as good. And I was like, how do you know? I mean, okay. And we really needed the money to pay for that event. It was not 1,000 people. The contracts at hotels are huge. And we didn't make a business plan. We just kind of thought this is something that we should do and that we wanted to do. And we weren't meeting the budget because we didn't really make one. We just thought, get as many people to buy tickets and come as we can. And we had 350 people in the room, right, Doug?
Yeah.
Something like that. When we had great speakers, and many of them have all come back to speak at many of the other conferences again. Gary Taubes has spoken at every single San Diego conference. Eric Westman has spoken at almost every conference. And so many people we've been able to cycle through or have come to every conference that they could. Dave Feldman was just attending at the time, and he was carrying around his laptop showing people the graphs of his testing that he'd done at home on his cholesterol. And I remember someone coming to me and saying, did you see that guy with his laptop and he's showing his cholesterol numbers and he's been able to manipulate them by just what he's eating and then test like soon after and everything's different. Like, it's mind-boggling. And now you look and see what Dave Feldman's done. If you haven't heard of Dave Feldman, look up cholesterol code and Dave Feldman, and he's got some major research trial going on right now. Let's see. So we've done 7 San Diego conferences. We did San Francisco and Seattle along the West Coast. And then people were really asking us to come to the East Coast because many people in the Northeast didn't want to come to California or the East Coast in general. Long story, we ended up trying to plan like a getaway in the Caribbean, which didn't pan out, but we ended up settling on Florida. So January will be our 7th annual Florida Boca Raton event. Because we started in West Palm Beach, and this will be our 3rd Boca Raton conference coming up this January 2023. Pretty excited about it. It's looking to be one of the most impactful conferences that we've done. Even though so many of them have been great, this one is just really panning out to address the addiction component all in one day with an extra bonus workshop. Feels like the first conference we have been stressing about the numbers of being able to meet the contract and having enough people coming, where there's a good number of people and just intimate enough that we're all going to get a chance to get to know each other. So yeah, apart from all the conferences that we've been doing, we've spent a lot of time curating resources on our website. Back a few years ago, we had the opportunity, Robert Cybus had come into town, and we were able to go to dinner with him and Brian Lenskes and his wife, both their wives. And Doug was sitting at the table and he was saying, Rob, we have to, like, we're all chatting, but listening to his wisdom and all and things that he was saying and talking with Brian Lenskes, and we had questions, and Doug says, we have to record this. We need a recorder right here. But he said, let's make sure we plan to do some recording soon. And Doug asked him to, send him an email about some topics, and he sent him an email with 13 topics. And he says, well, I guess we could do a series. And they started with episode 1, and there were 13 episodes, I think. It's called Diabetes Understood. It's in the free video section on the LowCarbUSA.org site. I think there's a section called videos, could be under news and resources, videos, and then we'll say free videos. I think that's in the drop down there. And it's fascinating amount of information that Rob Simons provides in video, in this video series. There are a bunch of other free videos listed in those sections that go through many of the panels that were at a lot of the conferences, the final panel, some of Doug's opening remarks, and some bonus videos that are in there. I know he spent a lot of time putting in here the some science published papers. If you're ever looking for a specific topic, there's a way to search the papers that are listed here. Over the years, when Gary Taubes, like I was saying, has spoken at every one of our conferences, and he introduced us to Adele Height,
Yeah,
a
no,
place where kind of,
and she worked like for 9 months to get that done, and then when we got back from Australia and we went and put on that Seattle conference, that was where we launched, officially published the clinical guidelines.
May 2019.
May 2019, yeah.
So we published the clinical guidelines just after the Seattle event in 2019 on the LowCarbUSA site. And we knew it wasn't its forever home, and we knew there could be a better place. We just didn't know at that time what was going to develop. And Dr. Tro Kalajian was attending the Boca Raton conference in January 2020. And one of the first things he said when he came in the door, he was like, "Pam, you know, we need a society." And we were just greeting people and getting everybody their name badges, and everybody's just coming to town. And he's like, he had this like thing on his mind that he had to get off his mind. And he's like, "I keep thinking we need a society where everybody is supported and there's a safe place to come and it's accredited and there's been validity to it and there's documentation and there's science." And he's like, "And I think LowCarbUSA is posed to be, you know, like kind of lead that project." He says, "But I don't know, you know, what kind of bandwidth you guys have or where you're at right now." And I said, "You know, you should talk to Doug throughout the weekend while you're here." And he was only there for a couple of days because it was his 10th anniversary, and apparently he had to make plans with Rosette to go on a cruise. So I didn't realize, but he was only there for that day and a half or 2.5 days or something. And then he had to run off to go to the cruise, and he was fasting because he was going on a cruise. So he wasn't sitting down at the dinners every night. So we never got a chance to really talk with Doug because, you know, the rest of the times were all lectures. And I didn't realize, and Doug doesn't remember me telling him that Tro had been suggesting this, but over the next couple of months, Doug had seen him on Twitter saying he needed something like this. So they got in touch with each other, and Doug offered his assistance and in the development of this, and they started the conversation. March 2020, when the world imploded, Doug really put his head down and literally started figuring out how to start a nonprofit. And that's how the Society of Metabolic Health Practitioners was born over the next 9 months. I always say it's our COVID baby, because literally doing all the paperwork to start a nonprofit, starting the website, getting just the look and feel of what not only the look and feel of what the website is going to be, but getting the right information on there, moving the clinical guidelines over to that website, which was a brilliant home for it.
Yeah, and creating the whole accreditation process as well was a huge job in terms of making sure that it was not too hard, but hard enough, and that it was fair, and that different people from different areas, like, they could still qualify through their clinical experience and not insist that they do a bunch of training that they feel they already had done. So trying to find that balance and the membership structure and all of that was a lot of work.
Yeah, thankfully we didn't have to create other courses, so we could partner with the Noakes Foundation and the Nutrition Network, which was brilliant, because we had already in the back of our mind thought we should do something with our conference videos and create courses. And it was just an overwhelming thought for Doug and I to figure out how to develop something like that. So when they came to us and said, we're looking to partner, we thought that's brilliant, because we won't have to start from scratch and try to figure out how to create those courses. Teachers from across the world who can guide and teach anybody, from the non-medical professional who wants to. Now, I know a lot of us have wanted to pay it forward and pass on information and teach others once we learned this for ourselves. So there's a professional course for the nutrition advisor who, if you wanted to professionally help other people, you can get that certification and then go on for a metabolic health practitioner certification from there, like I'm doing. I have a medical background in diagnostic imaging, but I was in diagnostics. I wasn't in clinical treatment, and so I started with the nutrition advisor course, and I've gone through the pathway almost. I'm on the last course. So for the non-medical, for anybody, non-medical professional is going to start with the nutrition advisor course. For any medical professionals, you're going to start with the LCHF for professionals, which I've completed. And then the next course is the clinical modules.
LCHF in clinical practice.
Yes, and there's 3 modules. And then the ethics course, which I'm just ready to start almost. So anybody who wants to join me in the accreditation, we've gotten over 60 people now accredited in the first 2 years.
I think just on 60 now, yeah.
We've had people, maybe you were going to say this, and you could say it if I wasn't. We've had people write to us and say the accreditation with the Society of Metabolic Health Practitioners and getting their metabolic health practitioner credentialing meant more to them than it did when they got their MD or their pharmacology, clinical pharmacist credentials, or PA or nurse practitioner. It's pretty incredible. But this is changing lives, changing people's practice, and making you guys and the healthcare professionals more effective in doing what they went into their career to do, help people. It's pretty amazing.
I think so. I think the biggest thing for me with this SMHP is this accreditation process, and the fact that they can use these credentials, MHP, and what we've come to realize, as you mentioned just now, like how amazing people are actually feeling about getting that accreditation, how much it means to them. Makes us feel like we grab all the people on the board, that our vision of the value of this organization would be good, and it's proving to be so. But the work that's also going on, you mentioned earlier, there's a lot of stuff, or maybe offline here, that there's so much going on in the background that people don't know about, that maybe we should talk about here. We started with a few different committees, and some of them have kind of fizzled out a bit, and some of them have really taken off, and now new ones are starting to come in to fill the places of the ones that have fizzled out. As we learn what's important and what needs to be done, the resources committee, headed up by an amazing guy who's, I think, still an intern, but probably about to graduate really, really soon. Providing a bunch of resources, handouts, and the like for 2 different groups of people. One for patients, to explain to them how to do things, tools, etc. And then handouts also in a separate group for practitioners and physicians to teach that, single page handouts that will give them information that will help them implement certain things, depending whatever this handout is about, and also then points them back to the clinical guidelines that are that go into more detail a lot of the time. The advocacy committee, where we're working with a lot with the Nutrition Coalition and Nina Teicholz to try to find ways outside of just trying to get the US dietary guidelines changed, because I think that's a long-term project. But in the meantime, what can we do at a more grassroots level to actually advocate this, try and get it in, maybe somebody can get it into one school for their lunch program, and then use that as a template to grow it out to other schools. Projects like that we're looking to try to implement. The outreach committees, one of the ones that fizzled a little bit over the last 6-8 months. We haven't done very much, but I really want to get that back on track again. The idea of that is to reach more of the impoverished communities where they maybe don't have access to this information, or they feel that they can't do it because this is too expensive, and there's ways we can teach them how it can be done, you know, at a reasonable cost. And then all the different ethnic communities, you know, Vivian Lowe, who's on that committee, often points out that there are differences, metabolic differences between different ethnicities, and that doctors, if they could be treating someone, you know, an African American and a Caucasian person, there's sometimes things they need to take into consideration for those two different groups in terms of what is effective and what's not effective, what works and what doesn't, etc. And we need that documented, probably to be added in as an addendum to the clinical guidelines eventually. So we really need to get that group kickstarted again and get that going. And then as we consider this whole thing an international organization, and literally 5 minutes before we got onto this recording, I was on a Zoom call with a couple of people, doctors in Australia, who want to start the Australian chapter of the SMHP. So we were talking about what that's going to look like, and they're really gung-ho about starting to create courses and find ways to get doctors, as we were talking about, we most of the time we're preaching to the choir here. Most of the time the people that come to these events and stuff are already into it and they've come to learn more. Every now and then there's a few that haven't, and hopefully we convert them, but those people are in the minority. They really want to go after and put on seminars and training courses to get doctors that haven't been exposed to this information before. Maybe get CPD credits, CME credits approved for those things, that will encourage those doctors to come. Like Brian Lenskes came to our event for the very first time because we had credits. So we had CME credits and we were down the road from his practice. So yeah, we those are the people we really need to get to. We need to get to the people that haven't bought into it yet, that are still on the fence. Those are the people that need to get this information so that they can make better decisions about whether or not they want to incorporate this into their practice or not. So those are the things that are going on. And like Pam said to me, a lot of the time people don't know about all of this stuff going on in the background. They just see what's on the website, and that isn't always very clear.
Doug, you reminded me that one of the things that you were talking about, raising awareness to new physicians, is I think all of the committees on the SMHP have that in the back of their mind of different ways to reach people. The outreach committee reaching certain groups of medical students and physician organizations, membership organizations, and talking to them. We all have the plan of, how do we get to the Orthopedics Association, the Bariatrics Association, the endocrinologists we really need to reach, the dietitians organizations, the different organizations, and how do we, make a difference there? Do we need to plan to attend some of their conferences? Do we get some of the board members, which we didn't get a chance, to go through all of them? We should highlight, like you said, Rob Sybas, Mark Cucuzella, Eric Westman, Miriam Kalamian, Tro Kalajian, all these people who have a lot of experience, clinical experience, helping their patients throughout the years, writing research, who are there as leaders, who are there to help Doug as president decide on avenues to go on which things to put on the website. Then the committees, they have their chairperson and decide on which project should we, put first. But there are a lot of projects in mind. It's just you have to look and, address what can be done now. Where can we plan to do something in the future? And there's so much work that's why I always think couldn't possibly fit this into one video. Is there's, as we all know, there's so many areas in healthcare and nutritional guidelines and individual quality of life, awareness campaigns. There's so many areas that need addressing and need change that it often seems like really overwhelming to me, and it feels like we're swimming upstream and it's, one little step of progress and then we take a step back because of something in the news or something, but we're making progress. And you were talking about Matt and Laura being newly graduated medical students working in their internships and fellowships, residencies. And the two of them told us last year in Boca Raton, and which made you think I need to put them on a committee and get Laura on as one of the board of directors. Laura and Matt had already started and want to continue the work that they're doing to create guidelines for residents to learn the implementation of therapeutic carbohydrate reduction. So the clinical guidelines are there, Doug, and then a little bit more about the conversations you've had with them about those.
Yeah, and what was really impressive the other day was someone else that had just come on to join on that resources committee that's got a lot of enthusiasm about helping with that. So with the three of us, we're talking Matt and Charlie and myself, and during that conversation, Matt pulled up on the screen just an overview of a elective course that he and Laura have actually developed. There's a few things couple of videos we need to make in that to complete that now, but literally they've put this course together that we can now put out as promote as an elective option in med schools. And I never went to med school, so I don't know, but all the doctors in the room and Laura and Matt themselves are confident that we can actually get this in place, and that every med student won't have to do it, but it will be an elective. So that's some new medical students are going to get access to this information right from the start and not come across it when they're 50 years old and jaded and wanting to retire because they can't help anybody.
And getting sick themselves.
Nothing that they were taught at university, at least with regards to these chronic diseases, is actually helping us, just making it worse.
Yeah, or putting a Band-Aid on it. And they're also get to the point where they're getting sick themselves, which I feel like is like 60% of the audience that have come to the conferences that we've met. And anybody who's written to us and kind of observing and learning from their offices and their homes, that they got to the point where they were sick themselves. They were overweight themselves, and then recommendations weren't working for them. I can't tell you how many people who have written and you've shared their application for their accreditation, and we were in tears reading it because they wrote and said how sick they've gotten or how much they had gotten disillusioned in their practice because they weren't making a difference like they'd meant to. Andrew Aswari, when he got his, wrote in and he said, I was teaching diabetes classes. I was teaching how to treat and manage blood sugars. And he ended up pre-diabetic himself. And he said, there's something wrong with what I'm teaching if I'm doing everything that I'm teaching and I'm getting pre-diabetes. We're all working with all of you who are listening, everybody coming as a community coming together. I know that we've been trying to form more and more coalitions with the Society of Metabolic Health Practitioners. There's a practitioner listing that was originally on LowCarbUSA. Doc had started putting it there. It now leads from LowCarbUSA to the Society of Metabolic Health Practitioners, the SMHP's provider listing, practitioner listing, and that's also available if you go to the smhp.org straight. It's the list that for the practitioner listing. If you are listening and you need a practitioner to help you in this lifestyle to reach your goals, to look at your labs, look at metabolic health parameters, guide you in therapeutic carbohydrate reduction lifestyle, there's a long and growing international list. It's not just USA, it's not just North America, it's all over the globe and growing. So if you know anybody you could share this with that could add their name to the list, please do. That list needs to grow and grow and grow and grow and grow. Obviously, we need somebody in every city and in the around the globe.
In the world, pretty much, yeah.
Around the world, yeah. I lost my words. But there's a lot in Australia. There's quite a few in Indonesia because we met a huge group of people over there that Professor Tio is helping teach in his country. Everybody's trying to do a little bit of their part, even forming a local small community group that you can meet together over coffee or in a church or in a community center or in a park and get together and support each other to make changes and ask questions and just talk to like-minded people. People write to us all the time and say they want to do this or they are doing this and tell us how they're doing it. It's pretty fun because we all need to connect and support each other. So Doug's the president. I'm a volunteer. I do all the newsletters and quality assurance on here, social media. I'm more of the editor of the newsletter and the blog posts. Membership supports the efforts of all these things that are going on, but it also gives you access to the forums where you can have discussions where we really want to ramp up those discussions behind the scenes to help establish standard of care, ask questions, let people know that there's job openings, have discussion topics. The grand rounds, they're monthly. Those give CME credits to those attending in a series of grouping of 6.
Blocks of 6, yeah.
And then one thing we didn't cover quickly, Doug, the clinical guidelines. You were just talking to a couple of times over the last couple of days. I know this has come up. And one of the gals who was trying to decide if she wanted to renew her membership with the SMHP wasn't sure if she wanted to kind of support another organization that was making some work, getting some work done because she wasn't seeing all the stuff that we're talking about. I think that was one of the things that also reminded me that we need to talk about what's behind the scenes so that you all know if you're a member of LowCarbUSA or you're supporting LowCarbUSA efforts. If you're a member of the SMHP, you're supporting the SMHP efforts. And the clinical guidelines have now been translated into 10 languages. 11
translated into 10, not in 11 languages.
If you know of anybody who could help with any of the languages that aren't listed there, there's many more to go. Just Hindi was the last one, and one other Indian languages I think is in the works.
Apparently there's another one India in the works.
I don't think there's any Asian languages yet. Indonesian and Malaysian. Yes, there are. Some Eastern European, Hungarian, German, Italian. So we need a lot more. And the addendums, the condition-specific addendums to the clinical guidelines. There's a lot of discussion right now being done for the type 1 diabetes clinical guidelines. There's a group of people putting together a business plan right now because nobody can commit to the amount of work that Adele did for free for this huge clinical guidelines document. It's 23 pages without the SMHP agreeing to at least pay a group of people to do editorial writing, the clinical, what was the other kind of components, Doug? The clinical aspects.
So it's mainly to get really, really competent technical writers, and then also to pay for these papers to get published afterwards, because that's also not free. So the SMHP is basically one. That's another thing we actively sourcing funding for these projects now. We want to get one going on cancer and one on epilepsy and one on type 2 diabetes, and the other one we were talking about this afternoon was mental, all these different mental conditions that we found have so much benefit from reducing carbohydrates and that in the diet, and
neurological. I mean,
so now we want to get the Chris Palmers and Georgia Eves and that on a committee then to do a mental health addendum for these clinical guidelines, specifically psychiatric, because that's, in fact, I think deprescription and prescription oversight is probably even way more important with these psychiatric conditions than even with type 2 diabetes or something. That you have these incredible results, but it has to be very, very carefully monitored by someone like, a psychiatrist like Chris and that, who really understands this and who can manage the medications properly until they maybe eventually get off some of them. Just listening to this, especially if anything, if medications are involved in any way, and even more importantly, if they are psychiatric type drugs, then please make sure that somebody who really knows what they're doing is overseeing that whole process.
Yeah, definitely. And when you talk about epilepsy, it's the same thing. I know that, will epilepsy have its own, or will it kind of go with other neurological conditions? And Alzheimer's can go in both, like mental health or neurological.
Right. I don't know. I think epilepsy, I don't know, it may just be all on its own, but the physicians and the doctors and the scientists that are actually really at the coalface with those things will be better equipped, better equipped to decide and advise where that would fit best.
Yeah, for sure. There is also a very extensive resource that I was originally thinking about for LowCarbUSA.org, but on SMHP.org, you linked to what the Nutrition Network put together with Sarah Rice. Worked really hard on getting the references, resources for therapeutic carbohydrate restriction put together for general metabolic disorders, neurological disorders, other conditions. So there's a lot of research papers and published scientific papers.
I still think that that's become the go-to resource for trying to find papers in science about any of these subjects. She's done such a brilliant job of collating that and indexing it, that it's a masterpiece. It really is.
I know you had taken.
That's why I did. There's no way we could even come close to doing such a good job. So I just pointed straight to her work. Yeah.
Which reminds me, just a little inspiration and encouragement. Those clinical guidelines are for any healthcare professional. If you're listening, they're also for you to share with your colleagues. And if you're a patient listening, they're for you to share with your healthcare team. If they don't quite understand what therapeutic carbohydrate reduction can do, or how to help you implement it, or help their other patients implement it, how to make sure that prescriptions, that you make sure that they keep an eye on the medications and the dosages and how to deprescribe and when. That's all listed in those clinical guidelines in depth. So you can send it as a digital e-file to any of your healthcare team, or you can print it out. It's 23 pages. There are some of those resources, those kind of handout type of things at the end that Matt and them are working on. And you mentioned Charlie Cavo. He's got already some created, so there's going to be much more of those resources available, handouts for guide sheets, pamphlets, and flyers, and a lot more to come, so that there's more resources for everybody to share and use in patient care or individually. So, well, we wanted to thank you all for coming on here and helping us celebrate our 100th episode, 3 years into the podcast, 7 years into Low Carb USA, 2 years into the SMHP, a way to end 2022 and go into 2023. Thank you all.
Thanks for being with us. Yeah, here's to another 7 years.
Here's to another 7 years, and continue to inspire us, because we would never have continued to do what we're doing here if we didn't continue to hear stories from each and every one of you. Say how much you're feeling better. Say how much it's helped your family. Say how much it helped your practice and your patients, and on and on and on. So keep sharing your stories with us, and we'll keep doing the hard work behind the scenes. Thank you.
Okay, cheers, thanks. You've been listening to an episode of the Low Carb USA podcast. You can support us on Patreon at patreon.com/lowcarbusa.